Hi guys, welcome back to my channel. My name is Ziad, Crohn's disease patient, NHS worker and educator, here bringing you IBD facts and taboo breaking chats. Don't forget to like, comment, share and subscribe on my channel. So let's get started. Hello and welcome to this lesson all about how IBD is diagnosed. So let's have a look at what we will be looking at today. So we're going to be looking at some of the preliminary checks, the laboratory tests, medical imaging and endoscopic imaging done to diagnose IBD. Now, the process of diagnosing IBD for some can be prolonged as it will depend on the severity of the symptoms being displayed. This can cause some people to be undiagnosed or even misdiagnosed for months and even years before obtaining an official diagnosis. So let's look at the preliminary checks you will go through when you're first experiencing symptoms. So it's estimated that over 500,000 people in the UK have IBD, of which almost half of patients waited a year for their diagnosis, with 1 in 5 waiting 5 years or more. The longer IBD is left undiagnosed, the poorer the prognosis and the higher the risk of complications are, as it allows the disease to progress further, causing further damage to the bowel, which can cause life-threatening complications, as well as increasing the risk that medications won't have much of an effect. In the early stages of displaying symptoms and trying to receive a diagnosis, you may hear the term suspected IBD being used. This is because there are several other conditions such as IBS, celiac disease, and diverticulitis which have similar symptoms to IBD, and so to obtain an IBD diagnosis, these other conditions will also be investigated alongside any IBD tests. The ways in which GPs can investigate suspected IBD has improved over the years, especially with the number of referral pathways being implemented, such as those with the Royal College of General Practitioners and Crohn's and Colitis UK developing a toolkit for GPs, as well as there being a fecal calprotectin pathway that gets you a referral to a gastroenterologist depending on the test results. So when you go to your GP, there are a few things that will happen first. The doctor will take a medical history which will allow them to note down what symptoms you're experiencing, how long you've been experiencing them for, what makes them worse, where they are located, and they'll also check if there are any presence of extraintestinal manifestations related to IBD, such as skin tags, anal fissures, abscesses, fistulas, and skin conditions. Now, the medical history will also include questions about any family history of disease, recent travel abroad, and lifestyle questions such as diet, smoking status, and alcohol intake. This, along with other demographic or risk factors collected, can help rule out any other conditions that could cause similar symptoms and help towards the indication that an IBD diagnosis is probable. You will also have a physical exam, and during the physical exam, the doctor will obtain measurements which can be used as a form of baseline to compare any future measurements to. So let's look at some of the laboratory tests that can be done to help indicate if IBD is present. So what tests can be done? There is no one lab test that can be done which will give a definitive diagnosis of IBD, and many of these tests will be used to help monitor your health if you have a diagnosis of IBD. Now, laboratory tests will usually be conducted to gain an understanding of what is going on inside the body by looking at certain levels in the blood of inflammatory markers. So inflammatory markers give an indication of whether there is inflammation present in the body. Inflammation is a natural reaction of the body that is used to fight off infections, and so anything can cause inflammation to occur. And these markers do not accurately correlate with disease activity or intestinal inflammation. However, with the presence of IBD symptoms, the following inflammatory markers can indicate that an IBD diagnosis is likely. And these are C-reactive protein, or CRP. This is a protein that is produced by the liver, which is released into the blood when injury to tissue, infection, or inflammation occurs in the body. High levels of CRP can indicate that injury or inflammation is present, and in those with a confirmed IBD diagnosis, it can be a good indication if a flare-up is occurring or how well treatment is working. The next one is erythrocyte sedimentation rate, or ESR. This test measures the time taken for red blood cells to fall to the bottom of a test tube. Now, red blood cells should fall slowly, but when inflammation is present in the body, it causes an increase in the number of clotting factors and antibodies in the blood, causing them to fall more quickly, increasing the ESR value. Now, hematologic markers, so your blood is made up of 3 different types of cells: red blood cells, plasma, and white blood cells, all of which are made and released by the bone marrow. By looking at the levels of these 3, the following can be determined. So if we look at full blood count, this is the most common test that is performed, which looks at the physical structure of the blood, as well as the levels of multiple components, of which subtle changes can indicate the presence of disease or conditions causing symptoms. Now we're moving on to biochemical markers, and these are markers that can be used to determine the overall health of an individual. Now, with regards to IBD, while abnormal levels cannot be used to give a diagnosis of IBD, they can be used to help monitor the overall health of someone with a known IBD diagnosis, or even indicate that something may not be right. So deficiencies in certain vitamins and minerals can be an indication that an individual is malnourished, which can be a sign of IBD if IBD symptoms are also present. The most common tests to be used to check for nutritional deficiencies are vitamin and mineral panel tests. Now, these tests can be used to measure the levels of vitamins and minerals present in the blood. Low levels of some can help explain symptoms such as fatigue and tiredness, and can indicate that either disease is occurring or poor nutrition is occurring in that individual. These tests can also include organ function tests, so those with a known IBD diagnosis who are on medication will often have regular blood tests to check the health and functioning of vital organs within the body. This is because some medications can affect these organs, as well as IBD can cause extraintestinal complications of these organs. So the first thing some people will have done is a liver function test, and this looks at and assesses the health and function of the liver by measuring multiple components either found or produced by the liver. There are certain enzymes that can be released into the blood when liver damage occurs, and liver damage can occur either because of the complications of IBD or because of the medication used to treat it. Another function test will be renal function test, or better known as kidney function tests, and this investigates your kidney function. So moving on to radiology imaging. So radiology is a branch of medicine where we can get images that help us see what's going on inside the body. This can be very helpful as it can help determine how well treatments are working, or if there are any other diseases occurring that may need treatment. So firstly, we're going to look at X-rays. So an X-ray is an examination that uses X-rays to produce an image of a certain area of the body. If having a plain film X-ray, the most common one would be an X-ray of your abdomen if abdominal symptoms are present. However, as IBD can affect the whole body, it's not uncommon for you to display symptoms such as joint pain, which can also be investigated using X-rays. The other type of X-ray examination is called a fluoroscopic examination. So the fluoroscopic examination used in IBD is known as a small bowel follow-through, which requires you to drink a white chalky substance called barium. This examination uses an X-rays given in pulses to provide a real-time image of the barium traveling through your small bowel. The barium is used because it will highlight any abnormalities that are present in the small bowel, which will then be visualized on the X-rays. The next type of technique used is computed tomography, which is also known as CT. Now, a CT scan is a machine that is shaped like a big donut, which uses X-rays to get 3D images of the body. CT scans can show some of the complications associated with IBD, such as abscesses, fistulas, bowel obstructions, and strictures, and it's a common imaging technique to use before you have surgery. With some CT scans, you may be required to drink a special liquid beforehand, which helps to highlight the intestines and helps doctors to detect any abnormalities in the bowel. And you may also be needed to have a cannula inserted, so IV contrast can be given, which highlights your blood vessels and other organs, which allows doctors to get a more detailed look at the health of your body. The next type of scan is a magnetic resonance imaging scan, or MRI. Now, it is a machine which is shaped like a CT scan, but it's a much narrower and is associated with triggering anxiety in people who suffer from claustrophobia. The similarities with CT include needing to drink a specialized liquid beforehand and needing a cannula, as well as it can show some of the complications associated with IBD. Now, because MRI scans do not use radiation like CT scans, they use powerful magnets and radio waves to produce the images, which is why most doctors prefer to use MRI for IBD, as it reduces the exposure to radiation, as people with IBD will require lifelong or more frequent imaging in comparison to the general public. Next, we're going to look at a dual energy X-ray absorptiometry scan, which is also known as a DEXA scan. So this scan uses low-dose X-rays to measure bone density, and this is how bone conditions seen in IBD, such as osteoporosis, can be diagnosed, as those with IBD are at a higher risk of bone loss and weaker bones. Probably one of the most underutilized scans is an ultrasound scan. So ultrasound examinations use high-frequency sound waves which are emitted from a handheld sensor to produce images of the body. This does not use radiation like CT and X-ray. The sensor is placed carefully against the skin surface of the body part being scanned to display real-time pictures on the screen, which can be recorded to view later. And lastly, we're going to look at endoscopic imaging. And the term endoscopy is a general term used to describe gastroscopy, colonoscopies, flexible sigmoidoscopies, and capsule endoscopy. So looking at gastroscopy, in this procedure, a camera is attached to a flexible tube, or the endoscope, that will be passed through the mouth and down the esophagus to look at the health of the stomach and the first portion of the small intestine. Sedation is usually given by either using a local anesthetic spray to numb the throat or a sedative to make you drowsy and less aware of what is happening. The most common procedures to have is a colonoscopy and a flexible sigmoidoscopy. Now, this procedure involves inserting a camera that is attached to a flexible tube up through the rectum to look at the internal health of your bowels. Sedation can be given to make you more comfortable during the procedure, but before you have the procedure, especially with a colonoscopy, you'll be required to follow a specialized diet and take laxatives the day before. With a flexible sigmoidoscopy, it is similar to a colonoscopy, aside from the camera only go as far as the sigmoid colon, and you only require an enema to be taken beforehand. Looking at capsule endoscopy, this procedure is also known as a small bowel video capsule endoscopy. It involves swallowing a small camera which is about 23 millimeters in size and disposable that contains a camera and a light source. This then takes pictures of your bowel as it moves along the bowel once you have swallowed it. Preparation for this examination is you'll be required to follow similar instructions as a colonoscopy to ensure the bowel is clear enough to be visualized by the camera. And what will happen, your doctor will be giving you the capsule to swallow, and you'll then remain in hospital for a short time to check that the capsule is actually taking pictures before you are sent home. So to summarize how IBD is diagnosed, we have looked at the different methods used to diagnose and monitor IBD, which include the preliminary checks, laboratory tests, radiology, and endoscopic imaging.